am Dr. Brooke Weinstein, and I am a neurologist.
I am Dr. Robin Stopford, and I'm an immunologist.
I am Dr. Talia Mala, and I'm an orthopedic surgeon.
I'm Dr. Ryan Morsano. I'm a gastroenterologist.
Patient info. Name, Mary, age 38. She is brought into the hospital with symptoms of a stroke. She is having trouble speaking and answering questions. She is having muscles on one side of her face are weak. Weakness of the muscles on one side of her body.
A stroke is when oxygen-rich blood flow to the brain is blocked. The types of stroke are hemorrhagic, which bleeds, a weak blood vessel breaks into the surrounding brain. TIA, which is transient ischemic stroke, which is a smaller, minier version of a stroke. Cryptogenic, which is an unknown causes of stroke. And ischemic, clots, a blood vessel is destroyed when going to the brain, thus it forms a blood clot, which makes it stroke.
Signs that you may be having a stroke are sudden face numbnesses and weaknesses. Arm or legs may be having the same problems, mostly on one side. Trouble speaking and understanding. You may also have sudden confusion or blurred vision in one or both eyes.
Symptoms of a stroke. Difficulty swallowing, difficulty talking, or trouble understanding someone. Poor memory and eyesight. You may also have pain or numbness in your body. Most strokes are caused by a blood vessel bursting or leaking, or an artery may be blocked. Some people might experience only a temporary blood flow to the brain.
Nervous system. A stroke can cause mental illnesses such as emotional changes that will lead to bursts of emotion like anger, choruses of laughter, or fits of crying. Right brain. Different sides of the brain control opposite sides of the body. Therefore, a stroke affecting one side will result in neurological problems. Neurological means the science of the nerves and the nervous system, especially of the disease affecting them.
Immune system. After the stroke, the immune system is weakened. Once the stroke is cured, the immune system begins to attack the brain.
The digestive system. In a stroke, you can have trouble swallowing. You can get dysphagia, which is discomfort in swallowing. Circulatory system. In a stroke, blood vessels can burst or leak. An artery can be blocked by a clot.
Medicine. Aspirin. An immediate medicine that you take to lower the chance of having a stroke. TPA, intravenous injection of tissue plasminogen activator. It is usually injected to a vein in the arm. It is a strong clot-busting drug that needs to be taken within 4.5 hours of the stroke symptoms.
Procedures. A medical clot removal. Doctors will maneuver a tiny device that will break apart or grab the clot. Medications delivered straight to the brain. Doctors will insert a tiny thin tube that will go through the groin and deliver TPA.
Respiratory system, alteration in breathing pattern and control. You can get pneumonia. Pneumonia is when you get lung inflammation and your alveoli fill with pus and maybe become solid. Disturbances in your respiratory system are common after a stroke. Thrombolytic therapy is the use of drugs to break up or dissolve blood clots, which are the main cause of both heart attacks and stroke. Thank you for watching our presentation.